record-setting outbreak of the Omicron variant. The number of new COVID cases reported yesterday hit an all-time high for the U.S., more than 400,000. With the numbers rising so fast, some doctors say it was premature for the CDC to lower its guidelines for isolation and quarantine. Joining us now is Dr. Celine Gounder, an infectious disease specialist at NYU and Bellevue Hospitals here in New York. She was a COVID advisor for the Biden-Harris transition team as well. Thank you so much for being with us. I want to jump in right away because there is just so much confusion about all this and so many people talking about why did the CDC not add an antigen test and have you test negative once you're out of this 5-day isolation period that they're now talking about. You think it's because of a lack of tests. We talked to Dr. Walensky a little bit earlier from the CDC, and she says they don't really do what we think they do, that they don't show how infectious a person is, and that's why they scrap some of this. Can you break down for us what you think is really going on?
Jamie, I think it's a combination of both. And frankly, the FDA has had 2 years to do these assessments that Dr. Walensky is referring to, whether they're as good to make that initial diagnosis to say you're contagious as they are for saying you are no longer contagious. They've had 2 years, and they've been dragging their feet for 2 years on approving rapid antigen tests. Initially, there were only about 2 that were available. And then over the summer, it became clear, look, vaccination is not getting us to the other side of the pandemic as quickly as we had hoped. Our vaccination rates plateaued, and there was a recognition that testing was going to have to be a priority. And that's when the administration, when the FDA started to approve more rapid antigen tests to open up supply. But they've really dragged their feet on this, and that is really not an excuse. And that's on top of the fact that we don't have enough rapid antigen tests and other tests available, which I think is really indeed driving the decision not to include that as part of the protocol here.
Now, the CDC says that masks should be worn another 5 days after isolation. Is that sufficient enough?
Nate, I think that's sufficient if people actually wear the mask. But we have learned over the course of the pandemic that the masks have been politicized, that people are not wearing masks when they should be. And even if they do wear a mask, they're often wearing them on their chin, under their nose. I just traveled back from visiting family in Missouri over the holidays on Sunday, and the number of people who were inappropriately wearing their masks despite a federal mask mandate was really shocking in the middle of this Omicron surge.
Dr. Gounder, there is some confusion when it comes to masks, and I'm just asking this personally. You know, I can be in New York, and there's a sign outside of an establishment that says you must wear a mask. And then I go across the bridge to Jersey, and I don't see that, and I don't see people wearing masks. Will there be some uniformity? Because you have said that we all need to up our mask game when it comes to Omicron.
The challenge here is that our public health decision-making, much of it actually resides at the state and local level. So New York City can decide to have one regulation, and New Jersey over the border of the state can have a different regulation. And so you are going to see patchiness across the country in terms of what is being asked of you.
So, Dr. Gounder, it's Vlad. What worries you as we head into the new year? I know that we've had a pretty rough couple of months with Delta and now with Omicron. Could we see another variant coming down the line that could even be more deadly or contagious than Omicron?
Vlad, in the short term, what worries me is what this is going to mean for hospitals. We are really short-staffed right now. Over the holidays, we work with a skeleton crew as it is. And then on top of that, many of our healthcare workers are actually out sick themselves with Omicron. They're not being allowed to care for patients while infectious, logically. And so it's really hard right now to be a healthcare provider at the hospital. And also seeing what's happening in the community, people still not taking precautions, seeing case rates go up, seeing hospitalizations really starting to creep up. That's very concerning. With respect to variants, there will be more variants. And the more we allow the virus to spread, to replicate, every time it replicates, it mutates. And some of those mutations will give rise to more variants. The way to slow that process down, the emergence of new variants, is to get more people vaccinated as quickly as possible.
When you talk about hospitalizations, I know a lot of parents are looking at the numbers when it comes to pediatrics and seeing those numbers creep up for kids entering the hospital. Is it safe for kids to return to in-person classes once this holiday break is over? And what do you say to parents who have to put their kids into daycare?
This really comes down to whether all the different mitigation measures are being utilized. So first of all, if you have a child who's 5 and up, they should absolutely get vaccinated. That's the best way to help reduce their risk. But on top of that, we really should be having kids over the age of 2 wearing masks. I mean, I can tell you my niece, who's 2 years old, she knows when you leave the house, you wear a mask. That's the first thing she grabs in addition to her coat when she heads out the door to the playground. So I think that's not an unreasonable expectation, even for young children. And then there are things like HEPA air filtration units, opening doors and windows. Testing is really important here, this whole test to stay notion, where even if you've been exposed to somebody who has COVID as a student in the classroom, as long as you continue to test negative, you can stay. I think we need to be using all of those tools at our disposal to keep kids safe.
As we get ready for the new year, we have to understand that we are still in this fight against COVID. Dr. Gounder, thank you so much for your valuable information.